All right, diving right in. Today we're tackling the renal
The
system.
renal system.
Yeah, and we always like to do these deep dives with a good source. And
Yes.
today's source is a pretty tough renal system quiz.
Oh, fun.
So hopefully by the time we're done with this, you will be a renal system whiz.
I love it.
Especially if you are studying for nursing school, this will be a really great way to review.
Yeah, or if you're just interested in how your body works.
Absolutely. So right off the bat, this quiz jumps into catheters.
Okay.
And it goes over the basic ones, like, just the straight catheter if you're just getting a quick urine sample, or the Foley.
Mm-hmm.
But then it jumps into some more specific types, like a Coud catheter.
Right.
Now, why would someone need a Coud catheter?
Well, the Coud catheter, it has that curved tip,
Yeah.
and it's often used for men who have enlarged prostates.
Okay.
Because what happens is that prostate kind of blocks or narrows the urethra, making it difficult to advance a straight catheter.
So you need that curved tip to
Yeah.
kind of get around.
Exactly. You need that curve to navigate.
That's so cool. It's like they really thought about, all the different scenarios.
Yeah.
That's a good example of how medical devices are tailored to specific patient needs.
Absolutely.
Okay, and then it talks about a three-way catheter, which is specifically used after a TURP.
A TURP, that's a transurethral resection of the prostate.
Right, which is
To
for
surgery.
surgery to remove part of the prostate.
Yes.
So why would you need this special three-way catheter after that?
So with a three-way catheter, it allows for continuous bladder irrigation.
Oh, okay.
So after a TURP, there's a risk of bleeding and clots.
Right.
So that third lumen, it allows for fluids to be infused into the bladder to kind of flush everything out
Oh, that's cool.
and prevent those clots from forming.
So it's like a little washing machine inside.
Exactly.
I love it.
Keeping everything nice and clean.
And what you're looking for is that nice pale yellow or slightly pink urine.
Right.
And that means everything's healing well. Now, moving on from catheters to something a little bit more delicate,
All right.
incontinence.
Yeah.
And this quiz goes through four main types: stress, urge, overflow, and total.
Yes.
What did you think about these different types?
Well, I think it's important to remember that incontinence is a symptom and not a disease in itself.
Oh, okay.
So there are many different things that can cause it.
Right.
It can be temporary or permanent,
Mm-hmm.
and each type points to what's actually going on.
Okay, so let's break down the types.
All right.
So stress incontinence, I feel like a lot of people are familiar with this.
Yeah.
Like when you cough or sneeze and you leak a little bit.
Yeah, those little leaks, that's often due to weak pelvic floor muscles,
Okay.
especially in women after childbirth.
Right, so that's where those Kegel exercises come in handy.
Exactly, strengthening those muscles and bladder retraining.
Yeah, so you can kind of like train your bladder to hold it a little bit longer.
Mm-hmm.
What about urge incontinence?
Urge incontinence, that's that gotta go now feeling.
Oh, yeah.
That sudden, overwhelming urge to urinate.
Where you're like running to the bathroom?
Yes, and that's often due to bladder spasms or an irritated bladder.
Hmm. So what can you do about that?
Well, a lot of times it's about lifestyle changes,
Okay.
like watching what you drink, avoiding caffeine and alcohol,
Right.
increasing your fluid intake, which sounds counterintuitive.
Yeah, if you're already going a lot, why would you drink more?
But what happens is, when you don't drink enough fluids, your urine becomes more concentrated,
Oh,
which irritates the bladder.
interesting.
So aiming for around 3 liters of water a day can actually help.
It kind of dilutes it.
Exactly. It dilutes the urine and reduces that irritation.
So sometimes the solution is actually drinking more water.
Right. It's about addressing that root cause.
Okay, that makes sense.
Now, overflow incontinence is a bit different.
Okay.
That's when the bladder doesn't empty completely.
Oh, so you're not fully voiding.
Right. And that can lead to leakage.
I see.
It's often caused by an obstruction.
Like an enlarged prostate.
Yeah, exactly. Or something blocking the flow of urine.
So with that one, the treatment would be focusing on whatever's causing that blockage.
Right.
And then lastly, you have total incontinence, which sounds pretty severe.
It is the most severe type.
Yeah.
It's a constant involuntary loss of urine,
Wow.
and it can be due to a number of things.
Okay.
Often neurological conditions or damage to the nerves that control the bladder.
So that one can be a little bit more difficult to treat.
Yeah, it might require more complex solutions.
The quiz also briefly mentions nocturnal enuresis.
Yes, bedwetting.
Bedwetting. And it focuses on making sure the child goes to the bathroom before bed.
Right.
and maybe limiting fluids before bed as well.
Those simple strategies can make a big difference.
Yeah, so just trying to reduce that chance of the bladder filling up overnight. Okay, let's shift gears a little bit and talk about infections.
Right.
The first one that this quiz goes into is cystitis.
Cystitis, that's the most common UTI, a bladder infection.
And it seems like women are much more prone to getting these than men.
Yeah, we are, unfortunately.
Why is that?
Well, it's all about anatomy.
Okay.
Women have shorter urethras, so it's a much shorter distance for bacteria to travel
Oh, okay.
from the outside up into the bladder.
Makes sense.
E. coli is a common culprit.
Yeah.
That often comes from the bowel.
And what are some of the things that can cause this or that can make you more likely to get cystitis?
Well, sexual intercourse is a big one
Oh, right.
because it can introduce bacteria, and things like using spermicides or diaphragms
Okay.
can also increase the risk.
And the symptoms are pretty classic. It's
Yeah.
like that frequent urination, the burning. Sometimes you even see blood in your urine.
Right, you might have dysuria, which is painful urination,
Yeah.
pyuria, which is pus in the urine,
Oh, yuck.
hematuria, blood in the urine, and that burning sensation.
So if you're experiencing any of those, definitely go see your doctor.
Absolutely. And the good news is cystitis is usually very treatable
Okay, good.
with antibiotics.
And what did this quiz say about treatment?
Well, it emphasizes both lifestyle and pharmacological approaches.
Okay.
So first and foremost, increasing fluid intake,
Yeah, we're seeing that theme again.
right? Flushing out those bacteria.
Getting those toxins out.
And then it specifically mentions cranberry juice.
Cranberry juice, does that really work?
Well, cranberry juice can help acidify the urine,
Okay.
which makes it less hospitable to bacteria.
So it's not a cure-all.
Right, but it can definitely help,
Yeah.
especially combined with antibiotics.
And it lists a bunch of different antibiotics that are commonly used for cystitis, like norfloxacin and ciprofloxacin.
Yeah, those are good ones.
But it mentions something interesting about nitrofurantoin,
Oh, yeah.
that there's a potential side effect of Stevens-Johnson syndrome.
Yes, that's a rare but very serious skin reaction.
So that's something to be aware of.
Definitely. Always important to talk to your doctor about any potential risks and benefits.
Right. Make sure you're getting the right treatment for you.
Yeah.
Okay, so moving on from cystitis to a more serious infection,
Okay.
pyelonephritis.
Pyelonephritis, that's a kidney infection.
Yeah, it sounds a lot scarier than just a bladder infection.
It is more serious because now the infection has traveled from the bladder up to the kidneys,
Wow.
and it can affect one or both kidneys.
And what usually causes this?
Again, E. coli is a common culprit.
That E. coli, it's everywhere.
It is.
And what are some of the symptoms of pyelonephritis?
Well, you'll have the same symptoms as cystitis,
okay.
but you'll also have more systemic symptoms.
Like
Fever, chills, nausea, vomiting, diarrhea,
Oh, wow.
and that characteristic flank pain.
Flank pain.
Yeah, that's pain in your side where your kidneys are.
Oh.
It can be a deep ache.
So that's a good indicator that it's not just a simple bladder infection.
Right. If you have that flank pain,
Yeah.
it's a red flag.
And it mentions here that it's really important to get those urine and blood samples before starting antibiotics.
Yes, absolutely.
Clap.
Well, because it helps to identify the specific bacteria causing the infection.
Oh, okay.
So you can choose the most effective antibiotic.
It's like gathering clues.
Exactly. You want to know who you're dealing with
Right.
before you start fighting.
And I imagine the treatment for pyelonephritis is a little bit more aggressive than for cystitis.
It can be, yeah.
Okay.
You might need stronger antibiotics.
Okay.
And you might need to be hospitalized.
Depending on the severity.
Exactly.
Now, on to another condition that affects the kidneys,
Okay.
glomerulonephritis.
Glomerulonephritis.
And if I remember correctly, this is inflammation of those tiny filters in the kidneys called glomeruli.
You got it. Those little workhorses that filter the blood.
Yeah, and there are two main types.
Right.
Acute and chronic.
Yes.
So what's the difference between acute and chronic glomerulonephritis?
Well, acute glomerulonephritis, it often comes on suddenly.
Okay.
And it's usually triggered by a bacterial or viral infection.
Interesting.
And it's more common in younger people. And the quiz actually mentions a connection to strep throat.
Oh, really?
Yeah, so if you've had strep throat recently
Mm-hmm.
and you notice your urine looks a little funny, like cola-colored or smoky,
That doesn't sound good.
no, it's a sign of blood in the urine.
Oh, okay.
It's definitely worth getting checked out.
That's a good tip.
Yeah.
So how do you treat acute glomerulonephritis?
Well, the focus is on supporting those kidneys.
Okay.
So you might need dietary restrictions.
Yeah.
Bed rest.
So just giving those kidneys a break.
Exactly.
And what about medications?
You might need penicillin if there's a bacterial infection,
Right.
diuretics to help get rid of excess fluids,
Okay.
and corticosteroids to reduce inflammation.
So it's all about reducing that workload and helping those kidneys heal.
Exactly.
Now, chronic glomerulonephritis sounds like it's a little bit more long-term.
It is. It's a long-term condition,
Yeah.
and it can develop from the acute form,
Oh, okay.
or it can be caused by chronic diseases like lupus or diabetes.
And what are some of the symptoms of chronic glomerulonephritis?
Well, you might have headaches, itching, high blood pressure,
Right.
and even widespread swelling.
Widespread swelling. Wow.
Yeah, it's called anasarca.
Anasarca, I've never heard of that before.
It's basically edema all over the body.
Oh, wow.
So it's a pretty dramatic
So
symptom.
how do you manage chronic glomerulonephritis?
Well, it's all about managing the symptoms and slowing the progression of the condition.
Okay.
So you'll need to manage your fluid intake,
Okay.
restrict protein and electrolytes.
To reduce the stress on the kidneys?
Exactly.
Okay.
And you might need medications like diuretics and antihypertensives to control blood pressure.
Right, because high blood pressure can make things worse.
Absolutely.
It's all connected.
It is.
All right, now let's move on to obstructive disorders,
Okay.
starting with the infamous kidney stones.
Oh, kidney stones or urolithiasis.
Urolithiasis, that's a mouthful.
It is.
So the quiz mentions that things like immobility and recurrent UTIs can increase your risk of developing kidney stones. But what actually causes them to form?
Well, it often comes down to an excess of certain substances in the urine, like calcium, for example. When these substances become too concentrated, they can crystallize and clump together.
Oh, so they actually form little rocks inside your kidneys.
Exactly. They're like little crystals that grow and grow.
Wow, and I imagine that can be extremely painful.
It can be excruciating.
Yeah.
It's called renal colic,
Renal colic?
and it's often described as a sharp, stabbing pain
Oh, no.
that comes in waves.
And if a stone gets stuck and blocks the flow of urine?
That can be really dangerous
Yeah.
because it could damage the kidney.
Oh, wow.
It's called hydronephrosis.
Hydronephrosis.
So it's definitely something you want to avoid.
So early detection and treatment is crucial.
Absolutely.
And it mentions here that they usually do a 24-hour urine collection to analyze the composition of the stones. Why is that so important?
Well, because the type of stone dictates the best course of treatment.
Oh, that makes sense.
So if you have calcium stones, for example,
Yeah.
you actually need to maintain adequate dietary calcium.
Oh, really?
Yeah, it sounds counterintuitive.
It does.
But if you restrict calcium too much, your body will start pulling calcium from your bones,
Oh.
which can weaken your bones and actually increase your risk of forming more stones.
So it's about finding that balance.
Exactly. You need enough calcium, but not too much.
And what about other types of stones?
Well, if you have uric acid stones,
Mm-mm.
you need to limit purine-rich foods
Uh-oh.
like red meat, fish, and poultry.
Okay.
And if you have oxalate stones,
Yeah.
you need to avoid foods high in oxalic acid, like spinach, chocolate, tea.
Oh, man, that's tough.
It can be, but it's worth it to avoid those painful stones.
So it seems like diet plays a really big role in managing kidney stones.
It does, absolutely.
Are there any other treatment options besides diet?
Yes, there are medications that can help relieve spasms and even dissolve certain types of stones.
Okay.
And then there are surgical interventions,
Oh, wow.
like ESWL.
ESWL, what's that?
That stands for extracorporeal shock wave lithotripsy.
That sounds intense.
It is pretty cool.
Oh.
They use focused sound wave to break the stones into smaller pieces.
So they're basically blasting those stones apart.
Exactly. It's like a sonic jackhammer.
I love it.
Makes them easier to pass.
Now moving on to a more serious topic.
Okay.
Tumors.
Tumors.
And this quiz covers both urinary bladder tumors and renal tumors.
Right. So tumors that affect the bladder and the kidneys.
And what are some of the key differences between these two types of tumors?
Well, bladder tumors, they can be either benign,
Oh.
meaning non-cancerous,
Yeah.
or they can be malignant, which means cancerous.
Okay, so there's a big difference there.
There is.
And what are some of the early warning signs of a bladder tumor?
Well, one of the first signs might be increased urinary frequency. So going to the bathroom more often than usual.
Mm-hmm.
And another common sign is hematuria,
Hematuria, which is
blood in the urine,
blood in the urine, yeah?
but it's often painless.
Painless.
Yeah, painless hematuria.
So you might not even know you have it.
Exactly. Which is why it's so important to pay attention to any changes in your urinary habits.
So even if you don't have pain, if you're seeing blood, go see your doctor.
Absolutely. It's always better to err on the side of caution.
And what are some of the risk factors for bladder tumors?
Well, smoking is a big one,
Smoking. Yeah.
as is exposure to certain industrial chemicals.
Okay, so it's not just lifestyle, it can also be environmental.
Right.
And how do they diagnose bladder tumors?
Well, they'll usually start with a urine test,
Okay.
and then they might do a cystoscopy.
A cystoscopy.
Yeah, that's where they use a thin lighted tube to look inside the bladder.
Oh,
And
okay.
they might take a biopsy.
Right, to check for cancerous cells.
Exactly.
And then depending on the diagnosis,
Yeah.
the treatment will vary.
Right. It could range from surgery to remove the tumor
Okay.
to chemotherapy to kill the cancer cells.
So it really depends on the individual case.
Absolutely.
All right, and what about renal tumors?
Renal tumors or kidney cancer.
Kidney cancer. Yeah.
It's a bit less common than bladder cancer,
Okay.
but it can be just as serious.
And what are some of the risk factors for kidney cancer?
Well, again, smoking is a risk factor, as is family history
Oh.
and having certain pre-existing kidney disorders.
So if you have a family history of kidney cancer,
Mhm.
it's important to be extra vigilant.
Yes, definitely talk to your doctor about screening options.
And what are the symptoms of kidney cancer?
Well, in the early stages, you might not have any symptoms at all.
Oh, wow.
But as the tumor grows,
Yeah.
you might start to experience things like weight loss,
Okay.
a dull ache in your side.
Like flank pain.
Yeah, similar to flank pain.
Mm.
You might see blood in your urine,
Okay.
and you might even feel a lump or mass in your abdomen.
So if you feel a lump in your abdomen,
Definitely go see your doctor right away.
yeah, that's a big red flag.
It is.
And how do they diagnose kidney cancer?
Well, they'll usually start with imaging studies, like a CT scan or an ultrasound,
Okay.
and then they might do a needle biopsy to confirm the diagnosis.
So they'll actually go in and get a sample of the tumor,
Exactly.
and then based on the results,
Yeah.
they'll decide on a treatment plan.
Right.
And what are some of the common treatments for kidney cancer?
Well, surgery is often the first line of treatment,
Okay.
and they might remove the entire kidney.
Wow.
It's called a nephrectomy.
A nephrectomy.
And then they might also use things like chemotherapy or radiation.
To kill any remaining cancer cells.
Right.
And it mentions here that it's really important to monitor for complications after surgery,
Yes, absolutely.
like hemorrhage and respiratory issues.
Those can be serious complications.
Yeah, it's major surgery.
It is.
So they want to make sure everything's healing properly. Now, let's talk about a genetic disorder that can affect the kidneys.
Okay.
Polycystic kidney disease.
Polycystic kidney disease.
And this is a condition where multiple cysts form in the kidneys.
Right, they're fluid-filled sacs.
And how does this affect the kidneys?
Well, over time, these cysts grow and multiply,
Okay.
and they can enlarge the kidneys.
So they actually make the kidneys bigger.
Yes, they can.
Wow.
And they interfere with the kidney's ability to filter blood and produce urine.
So they're basically disrupting the normal function of the kidneys.
Exactly.
And what are some of the symptoms of polycystic kidney disease?
Well, early on, you might have high blood pressure,
Okay.
frequent UTIs, headaches,
Headaches, okay.
increased urination.
So it can kind of mimic some other conditions.
It can.
But as the condition progresses,
Yeah.
you might experience more serious symptoms.
Right, like flank pain,
Okay.
protein in the urine,
Mm-hmm.
and eventually signs of kidney failure.
So it's a progressive condition
It is.
that worsens over time.
Yes. So early diagnosis is really important.
Absolutely.
So how do they diagnose polycystic kidney disease?
Well, they'll often use imaging studies,
Like
ultrasounds or CT scans,
Okay.
to visualize those cysts.
Mm-hmm.
And they might also do blood tests to assess kidney function.
And what about treatment?
Well, the treatment focuses on slowing the progression of the disease,
Okay.
managing the symptoms,
Yeah.
and preventing complications.
So it's all about trying to preserve kidney function for as long as possible.
Exactly.
And what are some of the things that they do to manage polycystic kidney disease?
Well, they might manage high blood pressure,
Okay.
control pain,
Mm-hmm.
treat UTIs promptly,
Okay.
and make dietary adjustments.
Right, to reduce the stress on the kidneys.
Exactly.
And in advanced cases, they
Yeah.
might need dialysis or a kidney transplant.
That's right.
Wow, we have covered so much ground today.
We have.
From catheters to incontinence to infections, kidney stones, tumors, and even genetic disorders. It's amazing how much the renal system does.
It really is. It's like a whole world within our bodies.
It is, and we've only just scratched the surface.
Yeah, but hopefully this depth dive has given you a better understanding of how this vital system works.
And what you can do to keep your kidneys healthy.
Absolutely. We'll be back soon with more insights from our renal system quiz, so stay tuned.
Sounds good.
All right, welcome back to our renal deep dive.
Back for more kidney knowledge.
We're really getting into the nitty-gritty here with this quiz.
Yeah, it's getting pretty in-depth.
It is. So there's a lot of stuff in here about lab values and diagnostic tests.
Okay.
So I thought maybe we could kind of go through some of those.
Yeah, sounds good.
One thing that jumped out to me was this mention of, normal potassium levels being 3.5 to 5.5.
Potassium, yeah.
Why is potassium so important when we're talking about the renal system?
Well, potassium, it plays a really vital role in regulating muscle and nerve function.
Okay.
And that includes the muscles that control your heartbeat. So the kidneys, they're responsible for filtering excess potassium from the blood.
Okay.
So when the kidneys aren't working properly,
Yeah.
potassium levels can rise.
Oh, so that's not good?
Not good. It can lead to some serious complications.
So it's important to keep an eye on that.
Absolutely. Especially if you have any kidney issues.
It's amazing to think about how those little numbers on a lab report can tell you so much.
Yeah, it's like a window into what's happening inside.
Exactly. And then it also mentions creatinine.
Creatinine, yep, that's another important one.
So what is creatinine and why do we care about it?
So creatinine is a waste product that's produced by your muscles.
Okay.
And healthy kidneys, they filter it out of the blood.
Okay.
And it's eliminated in your urine.
So if your creatinine levels are high...
That means your kidneys aren't filtering as well as they should.
So it's like a warning sign?
Exactly. It's a red flag for kidney dysfunction.
And I imagine that's something that they monitor very closely in people who have kidney disease.
Absolutely. It's often used to stage chronic kidney disease.
Okay, so the higher the creatinine level, the more severe the kidney disease?
Right. Generally speaking, the higher the creatinine, the worse the kidney function.
Okay, and then there's some stuff in here about different medications that can affect the kidneys?
Oh, yeah, there are a lot of meds that can impact the kidneys.
And one that this quiz specifically mentioned was tobramycin.
Tobramycin, yeah, that's a powerful antibiotic.
And what's the connection between tobramycin and the kidneys?
Well, tobramycin is filtered through the kidneys.
Okay.
So if you have kidney problems,
yeah,
or if the dosage is too high,
yeah,
it can actually damage the kidneys.
So it's like a double-edged sword.
It can be, it's fighting infection, but it can also potentially harm the kidneys.
And this quiz mentions that an overdose of tobramycin can cause intrarenal failure.
Intrarenal failure, that means the kidneys themselves are damaged.
So that's not good.
Not good at all. It can lead to a rapid decline in kidney function.
So it's like a delicate balance.
It is. Finding the right dose and monitoring kidney function is crucial.
Definitely. And speaking of things that can impact kidney function, this quiz also mentions some dietary restrictions for certain kidney conditions.
Oh yeah, diet plays a huge role in kidney health.
And one specific condition that they mention was acute glomerulonephritis.
Right, that's when those little filters in the kidneys are inflamed.
And what do they recommend for people with acute glomerulonephritis?
Well, they often recommend restricting protein intake.
Okay, why is that?
Because when you eat protein, it breaks down into waste products.
Okay.
And those waste products have to be filtered out by the kidneys.
I see.
So by reducing protein intake, you're basically lightening the load on those inflamed glomeruli.
Oh, so you're giving them a break.
Exactly, giving them a chance to rest and heal.
Okay, and then they talk about dialysis, which I know is a life-saving treatment for people with end-stage renal disease.
Dialysis, yeah, it's basically an artificial kidney.
And one thing that this quiz specifically mentions is hypotension as a potential complication during hemodialysis.
Hypotension, that's low blood pressure.
Right, and why is that a concern?
Well, hemodialysis involves filtering the blood outside of the body.
Okay.
And that process can cause a shift in fluid balance.
Okay.
And if fluids are removed too quickly,
yeah,
blood pressure can drop.
Oh, that makes sense.
So it's really important to monitor blood pressure during dialysis.
Yeah, to make sure it doesn't get too low.
Exactly, and to adjust the treatment accordingly.
Okay, and then they talk about peritoneal dialysis, which I know is a different type of dialysis.
Right, peritoneal dialysis uses the lining of the abdomen as a filter.
Oh, wow.
And it mentions the importance of aseptic technique during this procedure. Aseptic technique, that's all about keeping things sterile.
Right. Why is that so important for peritoneal dialysis?
Well, because you're introducing a catheter into the abdominal cavity,
okay,
which is normally a sterile space.
Right.
So any bacteria that gets introduced could cause a serious infection.
So it's like performing surgery on the inside.
In a way, yeah, you have to be super careful to avoid contamination.
And then there's this stuff about renal biopsies.
Renal biopsies, yeah, that's where they take a small sample of kidney tissue.
And why would they do that?
Well, It helps them diagnose certain kidney conditions
Okay.
and determine the best course of treatment.
So it's like getting a closer look at what's going on.
Exactly. It can help them see how much damage there is and what type of damage it is.
And this quiz mentions that renal biopsies can be painful.
Yeah, I mean, you're having a needle inserted into your kidney.
Right. That can't feel good.
So pain management is really important.
Yeah, make sure the patient is comfortable.
Absolutely. And to help with healing.
Okay, and then there's this stuff about sodium levels.
Sodium, yeah, that's another important electrolyte.
And the quiz mentions that normal sodium levels are between 135 and 155.
Right.
Why is sodium important for the renal system?
Well, sodium plays a big role in regulating fluid balance. So the kidneys, they control how much sodium is reabsorbed back into the bloodstream.
Okay.
And how much is excreted in the urine.
So if sodium levels are too high or too low,
it can throw off that balance.
It can cause problems.
Yeah, problems with blood pressure, nerve function, even brain function.
So it's all connected.
It is. Everything's connected.
And then they talk about cloudy urine.
Cloudy urine, yeah, that can be a sign of a few different things, like a urinary tract infection, dehydration, kidney stones, even some more serious conditions.
So if you notice your urine is cloudy,
definitely get it checked out.
And they specifically mention the importance of a culture and sensitivity test.
Oh, yeah. That's a crucial test.
What does that test do?
It helps identify the specific bacteria causing the infection.
Okay.
And it determines which antibiotics will be most effective.
So it's like a personalized treatment plan.
Exactly. You want to target the right bacteria with the right antibiotic.
Okay. And then finally, they talk about that intense flank pain that we mentioned earlier.
Oh, yeah. Renal colic.
Renal colic, the pain associated with kidney stones.
It's brutal.
Yeah, it sounds awful.
It's often described as one of the most intense types of pain.
Wow. And I imagine it comes on pretty suddenly.
It can hit you like a ton of bricks.
And it's usually on one side?
Right, depending on which kidney is affected.
So if you're experiencing that kind of pain,
get to the doctor.
Yeah, don't mess around with that.
Absolutely not.
Wow, we have covered so much today.
We have, from lab values to diagnostic tests to all sorts of conditions that can affect the kidneys.
It's mind-boggling how much there is to know about this one system.
It is. The renal system is so complex.
But it's so important.
It is. It's essential for life.
Absolutely. So we hope you're finding this deep dive helpful.
Yeah, we're trying to give you all the information you need to stay healthy.
And we'll be back soon with our final thoughts on the renal system, so stick around. And we are back for our final thoughts on the renal system.
It's amazing, isn't it, how much we've learned about these kidneys.
Yeah, we started with like the very basics, catheters. And now we're talking about dialysis and transplants and genetic disorders.
It's a whole world in there.
It really is. And it makes you realize how important it is to take care of them.
Oh, absolutely. Prevention is key.
Yeah. I mean, we've covered some pretty serious stuff today.
We have.
But a lot of these problems can be avoided.
Right, with the right knowledge and lifestyle choices.
Exactly. So if you're listening to this and you're thinking, okay, I need to step up my kidney game.
Good.
We've done our job.
Mission accomplished.
So what are some of the key takeaways that our listeners should remember? Like, what can they do to really keep those kidneys happy and healthy?
Well, first and foremost, drink plenty of water.
Water, yeah.
Hydration is crucial.
It seems so simple, but it really makes a difference.
It does. It helps flush out toxins, prevents kidney stones, keeps everything running smoothly.
Okay, water, check.
What else?
Diet is huge. Diet, yeah.
Watching your salt intake.
Okay.
Limiting processed foods, red meat.
Those things that we love.
I know, but they can really put a strain on the kidneys.
So maybe just moderation?
Moderation is key.
And if you have any underlying conditions like diabetes or high blood pressure.
Well, yeah, managing those is crucial.
Right, because those can really take a toll on the kidneys over time.
Absolutely. So keep those under control.
And of course, if you notice anything unusual.
Like changes in your urination or any pain.
Yeah, any red flags.
Don't hesitate to see your doctor.
Early detection is so important.
It is. The earlier you catch something, the better the outcome.
All right, so to wrap things up, I think the main message here is...
take care of those kidneys.
They do so much for us.
They're little powerhouses.
They really are, so let's show them some love.
Drink your water, eat your veggies.
And listen to your body.
Exactly. If something feels off, get it checked out.
Great advice. Well, that's all the time we have for today.
It's been fun.
It has. Thanks for joining us for another deep dive into the world of medicine.
We'll see you next time.
Stay curious.